It's my duty to bring you valuable information relating to mother and child health issues. And without you, I won't be doing this. Thank you for constantly coming around to learn. I am Juliana Ome, reporting for duty. And the topic for today is puerperium. The processes of pregnancy and childbirth can be viewed as what happens with our clothes. You pull out your clothes from the wardrobe or your closet, wear them, and after use, you put them in the washing machine. Set your time at, let's say, 9 minutes. And after washing and rinsing your clothes, you get them out from the dryer, get them folded and arranged back into your closet. Until you have done all of this, you're not done with laundry. And the clothes are not back to how they were before you wore them. Same way, pregnancy is not over until you get your beautiful self back to how you were before pregnancy occurred. Puerperium is a period of 6 weeks or 42 days from the day of delivery. During this time, the body recovers from the stresses of pregnancy and childbirth. So puerperium is a critical period in the life of any household. If you successfully handle this stage, you can comfortably adapt to the new stage of life. That's the care of the newest member of the family. And this is what I hope to achieve with this health talk. Some people struggle to cope with this period, and the right information can make a difference. So stay with me till the end of this health talk so that you can pick up useful tips. Puerperium is also called post-delivery period or postpartum period. This is a very critical period in the life of anyone, so we'll have to plan for it. Planning enhances performance, just as we planned for pregnancy. Same way, if you plan for post-delivery period, you surely get the best out of it. Is someone wondering the difference between puerperium and perineum? They sound alike, but don't let them confuse you. Puerperium is a period of 6 weeks, as we said, after a woman delivers her baby. That's what we're talking about today. While perineum is the area between the anus and the vagina, where a cut is given as the baby is coming out during vaginal delivery. That topic has been dealt with already. There is a comprehensive health talk on my channel on care of the perineum. So don't let them confuse you, okay? So now, during this period of puerperium, there are normal changes every woman should expect. The womb will go back to how it was before pregnancy. The vagina and the cervix, where baby came out from, will shrink back to their sizes. If you were given a cut or the baby injured you during delivery, the place will heal during this period. You know that feeling of soreness in the vagina, you will also start feeling better. Then the chemicals that your body produces to help you carry the pregnancy, the hormones, will disappear from your blood. And another group of chemicals will appear in your blood to help you breastfeed. Then there's a unique event that occurs in a woman's life after delivery that we need to talk about. After delivery, the womb cleans up itself by removing every blood inside of it, everything inside of it. And as this is happening, the woman will have some discharge as if she's seeing her menses. The difference between this discharge that's coming out after delivery and the menses is that your menses will be red throughout the 4 or 5 days of your flow, while the discharge that comes out after delivery usually change color from red to pinkish to white, and it usually stays longer. Now this discharge is called lochia. Whether you deliver through CS or through vaginal birth, the womb must clean up itself, so the discharge will flow for some weeks. The first week, the discharge will be red in color like normal menses. The second week, the color will be pinkish, not really red, not really white. Then the third week, it will become whitish and scanty, and it will continue that way until it dries up. So lochia flows out from the womb, and it should not have any offensive odor. Once it gives off any bad odor, run to your doctor. And if bleeding continues, notice that the lochia is heavy, run to your doctor. Please, mothers, hygiene is very important at this time. Use clean pads, buy enough pads and keep. During your antenatal visits, the midwife will hand you a list of items to get in preparation for delivery. So some of the items are used in the hospital, some are for your use at home. Please buy all your items and keep. You don't need to have all the money in the world to have a decent post-delivery period. Start early. Once you confirm you are pregnant, start keeping some money aside. Buy every item you need. You need pads for yourself, a lot of them. So as you're stocking up baby's diapers and wipes and all that, be buying your own items too, like pads. Buy enough of it. Some mothers do not prepare enough and they try to manage and they can become infected because of poor hygiene. Now, I listed up about 10 activities to know about the puerperium, and there may be more, but these 10 activities are very important and I want you to pay attention. The first is rest. Rest, rest, and rest. Please, mothers, it is your right to be helped. Get some rest. Allow people to help you, especially if you are used to doing things for yourself. You might be tempted to say no to extra hands. Hello, mothers in the house. Once baby arrives, there's a new boss in your life. Most mothers do not know this, especially first-time mothers. But trust me, once you have a new baby, the pattern of the things in your life will change for good. Anyways, most times baby will determine what you do and when you do them. Something as simple as sleep will become a big deal for you. It might not be business as usual. So once that little angel sleeps, do the same. Sleep. Sleep as your baby sleeps. Number 2, eat well. Balanced diet is just the best. Eat lots of vegetables, fruits, balanced meal, carbohydrate, protein, drink lots of water. In fact, replicate the colors of rainbow on your plates. Some mothers could not retain much during pregnancy, maybe due to excess vomiting or indigestion. Please, once baby is out, eat properly. This is not the time to start dieting or going to the gym. Your body needs all the nutrients it can get to help you recover. The process of breastfeeding and the process of recovery will place a lot of demand on you. Some mothers come down with shortage of blood at this period. Please don't let this happen to you. Eat balanced diet, okay? Number 3, breastfeeding. This is a special role, and mothers, give it time because it will take some time from you. Just like most things with having a baby, you need to be committed to breastfeeding. Breast milk is better than any other infant milk. Breast milk is the best, the most nutritious, and the cheapest for your baby. Number 4, take only drugs prescribed by your doctor during the post-delivery period. See, once you deliver your baby, everybody becomes an advisor and a doctor by experience. You hear things like, when I delivered my 4th baby, so and so happened and I bought so and so drugs and it cured it. Please, go to your doctor. Pregnancy and delivery, no customer. Even for a woman that has delivered 10 times, each one is a unique experience. Don't let people use you for their trial and error practice. Mothers, be wise. Go to your doctor. Okay, and get treated for any complaint at all, no matter how slight. Go to your doctor. Number 5, follow up your visits to your doctor if you have any appointments. If during your pregnancy you had any condition like maybe diabetes or hypertension and the doctor gives you an appointment date for checkup, this is a must. Don't assume that you have delivered, your baby is so cute and you feel all right so you can stay at home. No. Please, it is not over until it is over. Make sure you see your doctor on the date of appointments. If in your pregnancy you didn't have any condition at all, your doctor will ask you to return in 6 weeks for Post-Natal Clinic. For those that deliver through CS, your stitches will need to be removed, so you go to your doctor for follow-up dates. Then number 6, immunization services for yourself. The vaccines you started during pregnancy, like tetanus, will be completed during puerperium, and other vaccines that you were not allowed to take during pregnancy, the live vaccines like rubella, you need to take them after you deliver. Please, mothers, use this time to build your immunity. Mothers who are rhesus negative, if you're not given an injection during delivery or after delivery, you will need this injection to protect your future babies. Please take it at this time. Then number 7, immunization for your baby. This is very important. The baby looks fresh, beautiful, healthy, but needs to build up immunity. So please go for immunization for your baby. The time interval between the visits for baby immunization will depend on the healthcare system in the area where you live. please do well to go to the hospital for baby's immunization and keep to the dates, okay? Number 8, circumcision day for our male babies. Please don't miss this, okay? Take your male babies for circumcision. Number 9, Post-Natal Clinic. This is the official last visit to your daughter that tells you they have successfully gone through the processes of pregnancy and childbirth. Once you get to the doctor, you are thoroughly examined, your BP is checked, there's physical examination, your womb is checked, and they make sure that everything has gone back to normal and you don't have any complaints. And if you have, it will be duly taken care of. A lot of mothers, so many mothers don't benefit from this care because they feel it's not necessary and they just go their way. No, ma. It is very important. Whatever has a beginning has an end. You started with preconception care and antenatal care. Do your postnatal care and be freed. Then number 10, family planning clinic. From a postnatal clinic, your doctor will refer you to family planning clinic. And if you are due for a cervical screening, this is also a time to do so. Delivery is not an excuse for you to go for your screening. Go for your Papsmear if you are due. And then other activities, they are all individualized depending on your health care condition and then the system of care where you are. Now, there are some things that can be strange to some people, especially first-time mothers. I want to take note of the following. Your stomach does not immediately become flat after your baby comes out. Your womb will still be like a small pregnancy and the skin over your tummy will shrink. It will not look so beautiful, but it's okay. After a few weeks, you'll be all right. The first time you have to go to the bathroom or to use the toilet, it's not going to be easy. Some mothers are afraid of it because they feel sore down there. The thought of weeing scares them. So see what you can do. You can sprinkle tap water over your perineum before you wee. It will dilute the painful sensation that direct contact with urine may cause. Then wipe dry after urinating. Then when you want to poo, just take a deep breath and know that you'll be fine. The tip to help is that you have to eat foods rich in fibers, vegetables, fruits, and be generous with fluid intake. Sometimes doctor will prescribe stool softeners for you. Do well to use them. And when you poo, after pooing, please wipe from front to back. Okay? One stroke. Don't contaminate your perineum with feces. And again, some mothers may cry a few days after delivery. They will have mood swings, blues and all that. Just relax, mothers. Take it easy with yourself. Anything at all can make a mother cry during this period. Maybe baby is crying too much and refusing to cry. Next thing, mother will join the chorus and be crying. I remember the first time I saw this happen to a close relative. It was strange, but it's okay. So, and again, some new mothers, just the act of having to search for hospital card in preparation for follow-up, they are crying. What's the problem? Why are you crying? Is it not just hospital card? Oga, husband, calm down. Take it easy with her, okay? Help her find the card. And the mothers, there's nothing like ideal behavior for a new mom. Express yourself, okay? That is why you have to allow support from your family members. Those that care about you should be around at this time. You should have this worked out long before delivery dates. Call your mother, mother-in-law, your sister-in-law, and everyone that you're comfortable with. It is okay to ask for help. Now, breastfeeding will make your womb painful. New mothers, listen to me. Good things don't come easy, right? You need your womb to go back and your stomach should be flat, right? And breastfeeding will help you achieve this. Once baby puts mouth on your breast, your brain will release a chemical called oxytocin. This is the same hormone that was released to help push out your baby. It flows into your blood from your brain and it will help push your womb back and get your flat tummy back for you. And after a few days, the pain will stop. Then the big one. How much money can one get ready for post-delivery period? There's so much to buy, and some items you bought during pregnancy, you find out that 1 month after delivery you cannot use the items anymore. Please mothers, please parents, budget enough for delivery. Some new mothers are stranded few weeks after delivery because they did not plan enough. Well, it's not too late. Begin where you are. If you're listening to me and you're pregnant or you've given birth or you're even single but you plan to give birth someday, planning is your best strategy. Budget properly for your post-delivery period. Baby does not understand there is no diapers. Baby will poo whether there is diapers or not. Okay, so please plan properly. You can engage in pelvic floor exercises during this period to help you heal better and faster. Check my channel for the topic care of perineum or the details of this exercise. Now moving on, there are some danger signs you should watch out for during the post-delivery period. Most mothers don't ever experience these signs I'm about to list, but do your part to stay healthy and fit by doing what we have mentioned. If you have the following, see your doctor. Fever or chills, smelly discharge, your breast is so hard, tender and painful, or milk is not coming out, your womb is not going down weeks after delivery, you have severe pain, bleeding. Postpartum hemorrhage is the commonest cause of death in women during childbirth. It can happen even after you have been discharged from the hospital. Be observant, mothers. Once you notice that the discharge that comes out after delivery is becoming heavy, please go to the hospital. Don't delay, okay? Even if you do not deliver in the hospital, go to the hospital and be taken care of. There's a health talk video on postpartum hemorrhage. I attached the link to the description box of this particular health talk. Watch and stay informed. Once again, every mother has the right to life while giving life to another. Stay informed and stay alive. Hope you learned something from this health talk. Use the comment section for your questions, for your comments and all that. I will attend to them, okay? Well, to share with your friends and share the information with everyone you care about. Thank you very much and stay connected. Please subscribe if you are yet to, and see you.